What is asthma? Asthma is a disease that affects your lungs. It is one of the most common long-term diseases of children, but adults can have asthma, too. Asthma causes wheezing, breathlessness, chest tightness, and coughing at night or early in the morning. Theophylline, also known as 1,3-dimethylxanthine, is a phosphodiesterase inhibiting drug used in therapy for respiratory diseases such as chronic obstructive pulmonary disease and asthma under a variety of brand names. NAV. Identification. Summary. Theophylline is a xanthine used to manage the symptoms of asthma, COPD, and other lung conditions caused by reversible airflow obstruction. Brand names: Elyxyphylline, Elyxyphylline, Pulmifylline, Quiberon T, Theo24, Theolair, Unifil. Generic name: Theophylline. Drug Bank Accession Number: DB00277. Background: a methylxanthine derivative from T with diuretic, smooth muscle relaxant, bronchial dilation, cardiac and central nervous system stimulant activities. Mechanistically, theophylline acts as a phosphodiesterase inhibitor, adenosine receptor blocker, and histone deacetylase activator. Theophylline is marketed under several brand names such as Unifil and Theocrine, and it is indicated mainly for asthma, bronchospasm, and COPD. Type: small molecule. Groups. Indication: for the treatment of the symptoms and reversible airflow obstruction associated with chronic asthma and other chronic lung diseases, such as emphysema and chronic bronchitis. Build, train, and validate predictive machine learning models with structured datasets. Associated conditions: asthma, bronchitis, bronchoconstriction, bronchospasm, chronic obstructive pulmonary disease, COPD, chronic bronchial inflammation. Associated therapies: airway secretion clearance therapy, bronchodilation. Contraindications and black box warnings: avoid life-threatening adverse drug events and improve clinical decision support. Pharmacodynamics: theophylline, an xanthine derivative chemically similar to caffeine and theobromine, is used to treat asthma and bronchospasm. Theophylline has two distinct actions in the airways of patients with reversible asthmatic obstruction: smooth muscle relaxation, i.e., bronchodilation, and suppression of the response of the airways to stimuli, i.e., non-bronchodilator prophylactic effects. Mechanism of action: theophylline relaxes the smooth muscle of the bronchial airways and pulmonary blood vessels and reduces airway responsiveness to histamine, methacholine, adenosine, and allergen. Theophylline competitively inhibits type 3 and type 4 phosphodiesterase, PDE, the enzyme responsible for breaking down cyclic AMP in smooth muscle cells, possibly resulting in bronchodilation. Theophylline also binds to the adenosine A2B receptor and blocks adenosine-mediated bronchoconstriction. In inflammatory states, theophylline activates histone deacetylase to prevent transcription of inflammatory genes that require the acetylation of histones for transcription to begin.